part 5 of breaking down the components of the psychiatric evaluation, and you are currently here. We're now asking about their medical history, and this is important because medical conditions can cause and contribute to mental health symptoms. For example, thyroid conditions can look like anxiety and depression, right? And the treatment might just be to replace their thyroid hormone. Knowing their medical history also allows us to know which psych meds to avoid. Another example, if they have asthma, we know that we should not give propranolol for anxiety because it can cause bronchospasms, right? But if we didn't know that they had asthma, we might prescribe it. A patient with seizures, we know that they can't take Wellbutrin because Wellbutrin lowers the seizure threshold. Overall, getting the full picture of their medical and mental health history is going to improve treatment planning, and we can anticipate monitoring. So if they have a cardiac history, we know we need to get an EKG for stimulant. Then we can also understand the need to collaborate with specialists for more management. The medical portion of your EMR usually will have the vitals, height, weight, BMI, any urine and lab results, allergies, what reactions they have to it. We're going to ask about medications, what they're taking it for, any medical conditions. I specifically ask about thyroid, cardiac, renal, diabetes, seizures, pregnancy, liver disease, history of cancer, any visual or hearing impairments, and specifically if they've had any traumatic brain injuries, okay? Any specialists, we want to get their contact information, make sure they fill out an ROI, any hospitalizations in the past year, any surgeries in these specific areas. Then of course we want to get into the women's reproductive health history, specifically if they're pregnant or breastfeeding, because that's going to play a role in what meds we're going to prescribe. Then the medical review system. So this is just a brief screening of their physical symptoms currently, and we've all done this in health assessment class. There was a requirement for the Psych and P program. So in general, do they have any fever, chills, any weight loss, fatigue, cardiac, chest pain, palpitations, short of breath, any respiratory issues, GI symptoms, GU symptoms, and neurological symptoms, and any positive findings, you're going to refer to their PCP for treatment and management. And this is going to wrap up this portion, and I will see you guys in the next video.